My name is Sarah Kucharski and I am a patient advocate. I got involved in patient advocacy because I am a rare disease patient. And as a rare disease patient, it's extremely important to be able to be actively engaged in your care, to take a certain responsibility for directing your care, because you're yourself 24/7, 365, and that's a lot more time than the doctors will ever really get to spend with you. I was diagnosed with rare disease when I was 31, and it actually came about because I had done a lot of investigation into my own care. My background is as a journalist, and so I'd read all the information that I could get my hands on, done the research, read the medical journals, and actually written an email to a doctor at the Cleveland Clinic and said, I know that this sounds kind of crazy, but I think that I have this rare disease. And she wrote back and said, I think you're right. My medical history had been really complicated, that for years as a teen, preteen, I'd actually presented with gastrointestinal trouble. And nobody ever thought, oh, GI problems, vascular cause. It took a very long time for us to even get to the point that anyone started looking down that path. I went through having triple bypass surgery that ultimately failed. I lost my left kidney. I had a stroke, 4 brain aneurysms, 3 of which were coiled, and a gastric rupture. And after having that in a period of about 5 to 6 years, that's when I said, nobody has just this bad luck. Like, there's got to be something more here. There's got to be something overarching. And that's when I really got serious about doing my research and reached the diagnosis. Now, living with rare disease, anyone will tell you that it's isolating, because you're not just going to bump into somebody on the elevator who shares your same diagnosis. And it's not the kind of thing that there are support group meetings held in the local church basement. And so it's really about social media, that without the internet, without Twitter and Facebook and even registries and individual hospital systems, their forum boards, it would be so incredibly hard to find a patient community. We can be maybe a little less particular in that maybe a person doesn't have to share exactly our same diagnosis, but they are a rare disease patient too, and so they understand some of the struggles of achieving diagnosis, of routine care, of having anybody else who says, yeah, me too, I know what that's like. And as far as my health, knock on wood, everything's actually pretty good right now. Things have been quiet, and so from a just pure health standpoint, I'm doing great. So thinking about the patient experience and its role in healthcare. For rare disease patients, there's this saying of, when you hear hoofbeats, look for horses. But we need providers who are willing to entertain the notion that sometimes hoofbeats actually are zebras. We need people who are willing to think outside the box and be curious. Curiosity, I think, is one of the most valuable components of any person. It's what pursues you to find answers, to explore things, to get new knowledge about anything. And so I would encourage just that risk-taking, that curiosity, and if we can use that in a way that advances care, that it's not reckless. I think perhaps sometimes people think of curiosity and rare disease diagnosis as trying to be house MD, and it's not necessarily about that. It's about really just asking the questions to explore the possibilities. Having a rare disease, inherently, I think people, they hear that and they pause for a moment of, it may even very well be based in fear of, what is this thing? Can it impact me? Is it transferable? Anything like that. And rare diseases are really so much more common than people realize. Like, the last statistics that I read about rare diseases was that combined they affect more than like AIDS and cancer combined, because there are 7,000 known rare diseases. It just means that we're a very fragmented population, but chances are that you actually probably know someone with a rare disease, and there are diseases that you may have heard of that, you know, get a little bit more name recognition, that, you know, it's not necessarily as rare as you may think in a way. It's not something to be afraid of, because actually research into rare diseases has unlocked information about many more common diseases, that when you look at research studies and research arms that pursuing the mechanisms of these rare diseases, we can find out so much more about things that are more common, such as Alzheimer's or diabetes. My overall outlook on the healthcare environment has changed over the past 6 years or so. In a way, I feel like I used to be more hopeful because I was also more naive. Seeing how long change takes is maddening and depressing in a way. We're still trying so hard to push some of the same needles that we were trying to push years ago. And you know, I'm not someone who's been at this for 20, 30 years, and I'm frustrated. And there have been things that have happened politically that have pushed us backwards. And I worry that for people like me, we may lose some of the protections that we gained. I try very hard to maintain a sense of optimism. And actually, one of the guys here at Plaintree, his name's Alan Manning. He's actually, I think, VP of Plaintree. He gave a wonderful lesson on hope as a speaker here a few years ago, that he said, hope can change. Hope isn't a stagnant thing. That I had always worried that the people who felt like they hoped for change weren't maybe doing enough to impact it. But we can hope for different things, and that hope change along the pathway, that it grows, that it becomes something that expands based on what we've learned. And that's the first kind of definition of hope that I've ever really liked. It makes me feel like it does respond to the changes around us. And I want to encourage people to stay at it, to keep trying to make a difference, to maybe know when they get into it that the needle moves slowly, or at least know that they're not alone in feeling like the needle is moving so slowly. That may be a different problem that we have to solve. We talk about physician burnout, we talk about patient burnout. How can we address burnout from trying to make things better, from trying to find solutions, from getting ourselves to a point that we're not going to give up. The Plane Tree organization and this conference is something that I learned about, I think, 3, maybe 4 years ago. And I was utterly shocked that I had not heard about them sooner, because this was a group that I could say was actually doing everything right. That how they're approaching care, how they're focusing on patient-centered care, but from a very provider-focused angle, is really interesting. It's really encouraging, and it's something that I as a patient support, because we often talk about patient experience as being something that's so patient-focused without talking about the people who are actually supposed to provide the care, and caring for those people, making their environment, their jobs, their reward system something that is conducive to a healthy care environment. That's only going to benefit all of us. I hope that more people get involved with Plane Tree. I hope that more systems see opportunities for patient engagement that aren't solely patient focused, but that we have opportunities to contribute to measures that will improve provider, staff, employee care, so that they can do a great job of caring for us. You can find me online on Twitter at Afternoon Napper. I also have a blog by the same name, afternoonnapper.com, and on Facebook.